It's literally a part of almost every visit we do these days. Every checkup that we see, we do developmental screening from the little ones. We do mental health screening starting at about age 8 or 9, and that goes right through our teens and young adults, screening them for whether it's ADHD, anxiety, depression, other behavioral health disorders. And then we have numerous visits throughout the day that are follow-ups for those same types of issues. We all feel we have become default child psychiatrists over the last 5 years, particularly the last 2 or 3. I think a number of factors in our society, even before the pandemic, were starting to increase awareness and levels of mental health issues. I think social media is a huge one, particularly for adolescents. And we have seen, just especially since the pandemic, we have seen a phenomenal spike in the number of children and adolescents seeking help, utilizing services, counseling, medication, all of that. A number of patients in our practice in particular, but I think a lot of practices have the same kind of technology. We utilize a MyChart, and little known fact, in Massachusetts here, adolescents in their MyChart as of 13 have their own access. They have to grant their parents proxy access. So I have patients that will send me a message directly to me through their MyChart. They can also call the office and speak with one of the triage nurses if they have a concern to make an appointment, or have their parent call and do that. Because of the prevalence, I think we are definitely starting to see a decrease in the stigma of mental health, but we try to incorporate and talk with our patients about it really frequently, because we want them to understand that if you are dealing with an issue, we want you to get help for it the same way we would want you to get help for a sprained ankle or an ear infection. It is part of your total health, and we want to be there to help them with it.
The range of people that we see at crisis is, it starts from, someone coming through their first crisis moment, their first experience with the mental health world, to someone who might be a danger to themselves or others. So it's just a wide spectrum of people that we serve and help on a daily basis. The biggest thing, number one and foremost, is safety. Always making sure themselves or others are safe. After that, obviously, it's, getting supports and connected with providers and, everything like that. But first and foremost, safety. During situations in which someone's pre-crisis and possibly could go towards a crisis situation, it's important to make them feel heard, help them feel understood, while not saying that you are knowing exactly what they're doing or knowing what they're thinking, but just understanding and being there to listen and help them and connect them with whether they have to safety plan, and really connect them with those resources or whatever it might be, or even calling crisis pre-crisis and having someone other than a clinician come out. We have therapeutic mentors and family partners that can come out, work with the kid, and just really help that moment. There is such a stigma on people trying to find help, trying to get those resources out there, and though it has lessened some, there is still such a battle ahead of us to continue to fight it and to make sure people get the help they need before they get to that point.
I think some of the signs that you can look for someone needing assistance would be maybe through behaviors, maybe acting out, maybe not really paying attention in school, really just kind of, if they're struggling in any area, and asking, right? Asking how someone is doing. I've noticed seeing a lot of more anxiety symptoms, depression symptoms even, anxiety around getting COVID, around what happens if someone does, anxiety around, even being in a room with a lot of people, socializing, those kind of things. Depression is signs looking at isolation, kind of isolating yourself to keep yourself away from being in those situations. We do offer substance use support for individuals who come to us to seek services. And that looks like, whatever they need it to look like. We talk about the stages of change. We talk about kind of working through that. Part of feeling good. It's part of living the best life that you can, and really kind of being engaged in what that looks like, and having a say in what that looks like.
So asking for help sometimes can be very difficult. However, if you talk to an adult, you can talk with a teacher, talk with your counselor, and also utilize some of the support that you received here. We have Crisis that's also available if you need some phone support. And talk to your friends, your parents, your caregivers, your family, and please see something. If you see something, you say something, and someone is struggling, it's very important that you reach out for support for that person. As a mental health coordinator for the school district, there are many resources as far as accessing therapists, community resources, emergency food, housing. There's resources across locally. You can talk with your adjustment counselor, and your adjustment counselor can reach out to me as being that point contact person for your family or for yourself, and we would be able to provide support and walk you through that process.